If you notice it's getting harder and harder for you to go from sitting to standing, especially from a lower chair, try these progressions to improve your ability to perform a sit to stand transfer. Dr. Nicholas Mercer with uImproved PT. So as a physical therapist, I treat a few things, mainly pain and dysfunction. So basically, if you're in pain, I help people get out of pain. If you're having difficulty with certain movements, I help you be able to do those movements pain-free. Today I want to talk about one thing that a lot of my patients have difficulty with and that we've actually been working on in the clinic, and that is the sit-to-stand transfer. Now, that's something we have to do pretty much on a daily basis as humans in this day and age. We have to be able to sit for long periods of time and then go from sitting to standing. And a lot of times we're sitting in either low chairs, unstable chairs, so chairs that have like wheels on them, and even couches where you're slowly sinking down into that couch over time. And then when you go to get up, you're a lot lower than you were when you sat down. And you find it's just a lot more difficult and might even cause some knee or back pain. Now in this video, I'm going to cover why that happens. Why does it get more difficult to go from sitting to standing, especially as we get older? But also a few progressions you can do so you can start working and improving your ability to go from sitting to standing and to, once again, either improve that or prevent those decreases in function from ever happening. So why do we have trouble going from sitting to standing as we get older? Well, one reason could be weakness or what we call sarcopenia, which is kind of a weakness or muscle loss associated with aging. Obviously, if we have less muscle, we're going to be weaker and we're not going to be able to do the movements that we used to be able to do. Luckily, sarcopenia to an extent is preventable. By this, I mean if we continue strength training and doing the right exercises and progressing properly, we can maintain our strength in order to continue being able to do these transfers without pain and effectively and without dysfunction. Now, another reason these sit-to-stands can be getting more difficult is obesity. Not necessarily associated with aging, but if we have that sarcopenia combined with obesity, so we're getting weaker and heavier, that can obviously cause a lot of problems. If we're getting weaker while we need to move more weight, we are not going to be as strong or effective in our sit-to-stand transfers, and we're likely going to get a lot of pain either in our back or in our knees. Even obesity by itself without sarcopenia is going to make the sit-to-stand transfer a lot more difficult because it's more weight. You have to move more weight, and that is more difficult, especially if you don't have the strength to move that weight in the first place. Another thing you might notice is you have a lot of difficulty going from sitting to standing, especially when the chair is lower. Now, as the range of motion requirements increase for a transfer, it is going to be more difficult to perform that transfer. So in a lower chair, your knees have to flex more, your hips have to flex more, and so we're in this more flexed position, and it's going to be more difficult to get out of that more flexed position than it would from a higher chair. And finally, another factor that can contribute to this difficulty going from sitting to standing is just technique. So the proper technique when you're going from sitting to standing, as we say in the PT world, is nose over toes. We want to be able to shift the weight forward over the heels in order to stand up. If we can't do that, we'll basically just be pushing back, and that's not really going to help us perform the sit-to-stand transfer. In addition, if our knees aren't lined up with our toes, if we are not having a stable spine, that can cause pain even if we do have a successful sit-to-stand transfer. Well, successful. So we're going to keep all of that in mind as we go through these progressions for the sit-to-stand. So we're going to look at two different ways to progress. One is going to be with the chair height, and the other one is going to be with assistance from the arms. And you can even incorporate both of these different types of progressions into your training in order to improve your sit-to-stand. So we're going to start simple with just help from your arms. So obviously, when we do a sit-to-stand, if we're able to use both arms on the armrests that are present, it will be a lot easier to, one, shift the weight forward, push from the hands and push from the legs as we stand up, and then coming back down, getting those arms, and coming back down. The progression from that would be to still get the weight forward, push through the hands, stand up, but then as you come down, try not to use your hands. So we're pushing up, and then we're controlled, slow and controlled, back down. This eccentric movement will actually do a lot to increase the strength of the muscles that are responsible for getting you from sitting to standing. The progression from that would be one arm pushing through. Again, we want to primarily use the legs. The arm is just there to help. So we're getting our weight, nose over toes, pushing through the heels, pushing through the one arm, standing up. And then again, we want to try to come back down without using the arms. And then you can switch the arm, stand up, and then sit down without using the arms. The next progression would be to try to get your weight even more forward. And the way we do that is not by using the hands on the hand rest. We're actually going to bring the hands as far forward as possible, sit forward, shift our weight forward, push through the heels, stand up, and then keep that weight shifted forward as we sit back down. So up with the arms forward, and then back down. And then once you're comfortable with that, the arms will be forward, coming up, pull the hands in as you sit back down. Once you get pretty good at that, again, we're keeping the chair height standard for these ones. We are going to bring the hands into the chest, shift the weight forward, come up, and come back down, right? We want to keep the torso as upright as possible, but we also need to make sure that we are shifting the weight forward over the feet. And once you get good at that, we're going to add some weight. So we want to make sure the weight is, again, at our chest, holding it nice and safe. Bring that weight forward, and then push to the heels, stand up, and then slowly coming back down. Push to the heels, stand up, and slowly coming back down. Now, the other way we can progress is by altering the chair height. And so I have a foam AirX pad here, which has a lot of different uses, but for us, we're going to use it to elevate the chair height, and a yoga block will also be okay for this. It's a little thicker than the AirX pad, but it's also a little smaller. But anything where you can elevate the height of the chair or use a chair that's higher, like a bar stool, that is going to help you progress the sit to stand so that you can start to do it from lower surfaces. So all we're going to do is foam pad on the chair. For this one, since we're just starting out, we're also going to have the yoga block, and we're going to sit down so you see how much higher I am here, and then stand up and sit back down. Stand up, sit back down. Once you can do that pretty well, pretty consistently for sets of 10, we will take out the first elevation, and now we're just sitting on the foam pad. Okay, we're going to do this until we can do a few sets of 10. Over time progressing, then we're going to throw that out. No, all the way out. There we go. And then we're going to sit from the normal chair, just like so. Right? And once that gets easy, we're going to need to find a lower chair, and you'll slowly progress to lower and lower and lower chairs until you're able to basically do a full squat. Now, not everyone is going to be able to reach that progression, but if we can progress you to where you're able to do a sit to stand, even if you're using your hands from a surface where your hips are lower than your knees, that is going to be very, very beneficial. Also, keep in mind, not every chair is going to have armrests, so it is really good to practice both progressions so you can, one, be able to do a sit to stand without using your hands, and two, be able to do a sit to stand from lower surfaces. Start training those progressions in order to improve your ability to perform a sit to stand. However, if you do have pain with any of these progressions, you can check out our website, uimprovedpt.com, where we have a lot of free information on any various different types of pain. The more relevant ones for this would be knee, hip, and lower back pain. Although if you're having trouble pressing from the armrest, you may be having some shoulder pain or some elbow pain. Go to uimprovedpt.com. We have a lot of resources, a lot of free resources to help you out with that. In addition, you could also check out our YouTube channel. We have a lot of different videos on various different types of pain, particularly ending those different types of pain. And we are also going to be releasing a lot of pain relief courses, which are complete solutions to your back pain. hip pain, knee pain, shoulder pain, neck pain, various different types of pain, and those are going to be coming soon. Back pain one is on the way. It's almost done. So make sure you subscribe to our YouTube channel so you can know exactly when those programs come out. Practice these progressions for the sit to stand in order to move more, pain less.